By the end of this module, you will understand the full spectrum of recovery and reintegration after mental health crises, support individuals transitioning back into school, work, or community, implement relapse prevention tools and long-term wellness planning, engage families, caregivers, and communities in long-term mental health support, advocate for systemic changes that reinforce inclusive, safe mental health environments. Mental health first aid is not limited to initial response or crisis stabilization. It extends far beyond to include post-crisis recovery, sustained support, and the safe reintegration of individuals into daily life, work, school, or society. This module empowers you with in-depth knowledge and skills to assist individuals after they've experienced a mental health emergency, been discharged from care, or returned from psychological treatment or hospitalization. The module emphasizes a recovery-oriented approach based on hope, empowerment, peer support, and person-centered care, and highlights the roles of various stakeholders, including caregivers, employers, schools, mental health professionals, and community leaders. The content integrates both clinical recovery, symptom remission, and personal recovery, restoration of self-worth, purpose, and identity. Understanding the mental health recovery process. Mental health recovery is nonlinear and may involve periods of progress, setbacks, and plateauing. There are 5 key stages in the recovery journey: stabilization, immediate aftermath of crisis, restoring safety, adjustment, learning to live with a diagnosis or new reality, reconstruction, rebuilding daily routines, confidence and relationships, growth, finding meaning in recovery and setting goals, maintenance, preventing relapse, promoting wellness, and sustaining progress. Recovery frameworks used globally include CHIME, connectedness, hope, identity, meaning, empowerment. Wellness Recovery Action Plan, WRAP. Recovery colleges and peer-led initiatives. Psychosocial and emotional reintegration. Once an individual has stabilized, emotional reintegration becomes a priority. This involves rebuilding self-esteem damaged by stigma or illness, reestablishing relationships with friends, family, colleagues, overcoming shame and internalized stigma, practicing emotional regulation and resilience tools, CBT, mindfulness, journaling. Important support strategies: trauma-informed care, avoid re-traumatization, peer mentoring, support from others with lived experience, structured reflection, recognizing growth and progress. Reintegration into education or employment. Returning to school or work after a mental health episode can be daunting. This section prepares you to guide individuals or policymakers in creating inclusive reintegration plans. In workplaces, phased return to work plans, gradual reentry with modified duties, reasonable accommodations, adjustments like flexible hours or reduced workload, post-crisis debriefing, one-on-one or team-based, emphasizing non-judgmental communication, HR policies and legal protection under acts like the Equality Act 2010, ADA-USA, and ILO standards. In schools, reentry meetings with students, parents, and counselors, modified learning schedules to reduce pressure, bullying prevention and peer support programs, teacher sensitization to trauma and invisible struggles, relapse prevention and self-management. Key areas: identifying early warning signs of relapse, creating safety and support plans, e.g. WRAP, medication adherence and awareness of side effects, healthy routines, sleep hygiene, nutrition, exercise, use of apps and digital wellness tools, e.g. MoodPath, Calm, Headspace, peer and professional involvement, periodic wellness checks, remote counseling or group therapy access, family education on supporting without enabling, role of carers, family and community in long-term support. Recovery is most sustainable when surrounded by empathetic family systems, community-based resources, NGOs, religious groups, support networks, carer training on communication, boundaries, and compassion fatigue. Inclusive spaces where mental health conversations are normalized. This section also addresses caregiver burnout prevention, use of respite care and community engagement, crisis replanning and living wills for individuals with recurring mental health episodes, policy advocacy and systemic change, Mental health awareness extends into policy advocacy. You are trained to advocate for parity of esteem. Mental health equals physical health. Engage local governments or institutions for funding support. Push for anti-stigma education, accessible services, and mental health infrastructure. Join or build mental health coalitions, awareness campaigns, and citizen platforms.